Welcome to our health podcast. Today we're going to be discussing hepatitis C and how it is transmitted, its risks, what its symptoms are, the treatment, and prevention.
Hepatitis C is a liver disease caused by HCV, and it can vary from being a short-term or acute disease to being a long-term or chronic illness. Hepatitis C is one of the most common types of viral hepatitis in the United States.
Hepatitis C spreads through blood-to-blood contact. Sharing needles or any injection equipment, even one time, can expose you. You don't have to be currently using drugs to be of risk. If you ever injected, even decades ago, you could still be carrying the virus today without even knowing it.
Why testing matters. Testing is done in a few different ways. It's all mainly lab-based, it's mainly lab-based, quick, rapid test, and at-home based, all of which are testing via the blood for HCV antibodies. Getting tested for Hep C is the only certain way to confirm that you do indeed have hepatitis C, and is especially important if you think that you might have been exposed to the hepatitis C virus. As we'll talk about a little later, if undetected and untreated, Hep C can lead to a whole plethora of different complications.
Most people that have contact with hepatitis C will not show symptoms at all. If a person has hepatitis C, they might show acute symptoms that could start 1 to 3 months after being infected. Acute infections might show dark-colored urine, fever, fatigue, clay-colored stools, joint pains, nausea, yellow skin and eyes, or loss of appetite. Chronic complications can appear years after infection with no symptoms, but could lead to liver damage.
For most of the cases, there have been existing treatments to cure hepatitis C since 2014. The treatments that nowadays are used to cure this disease are oral direct-acting antiviral medications and regular care such as eating healthy, avoiding alcohol intake, exercise, etc. An early treatment can be very helpful to prevent serious complications.
Prevention is just as important. If you currently use injection drugs, never share needles or any equipment. Always use new sterile supplies, and if you used in the past, getting tested now can save your life.
All in all, hepatitis C has a range of symptoms and side effects that everyone should be on the lookout for, especially those who are at risk, like injectable drug users. There is a light at the end of the tunnel, though, regarding treatment, as this is a very treatable disease, especially if you catch it in the early stages. But to catch this early is to get tested at least once as an adult, once more if you're pregnant, and regularly if you are considered an at-risk user of injectable drugs. Thank you, and have a nice day.
This podcast was completed by Makenzie,
Dylan Prekaiski.
Dylan Kunz.
And Sofia Ortiz.